right, welcome back to PatientWin Insider. I'm Nick Moen, and today I'm joined by Dr. Ralph Mensah from Integrative Holistic Dentistry in Chapel Hill. So what happens when a dentist trades high-volume dentistry for whole-body wellness? Dr. Mensah built a practice that's redefining what it means to treat patients and himself holistically. So we're going to talk about burnout, balance, and the business of running a purpose-driven practice. Let's get into it. Thanks for coming on today, Dr. Mensah.
It's my pleasure, Nick. Thanks for having me this afternoon.
So just a little background to share with our listeners. You've owned multiple practices and made kind of a huge shift in your approach to dentistry. What was the pivotal moment when you realized something needed to change?
No, it's a great question. And I guess let me take a step back, give a little bit of background. 2008 graduate from UNC's Adams School of Dentistry, went straight out into private practice as an associate. I initially worked for a larger dental group for approximately 2.5 years. I would say a year and a half in is when I realized, even though I did learn a lot, that I did not want to be working for somebody else for an extended period of time. And that's what ultimately started, I guess, my journey as a practice owner. 2 years later, I did open up my first practice in Mebane, North Carolina, which is approximately 30 minutes away from the Chapel Hill area, from scratch. And through many years of building up that practice is when I started to realize that, as awesome as the practice of general dentistry is, I started to realize that there potentially could have been a better way to go about doing it. Practice was very successful. Experienced nominal growth every year, not only in patient base, but our team. And I would say probably close to 7 years in is when I would probably say I hit the proverbial wall and realized that things weren't ideally as well as they were when I had initially started practicing, i.e. fatigue, I would say just general irritability. My wife and I were pretty fresh into our marriage, and I realized I wasn't that same guy that I probably was when we first started dating. And it was during that time that I realized there was probably some things that I wasn't noticing in regards to my health. It was a conversation that I had with a classmate of mine who had already started practicing with the same philosophy that I do now, meaning wellness driven or holistic or biological. And he immediately said, "I bet you're experiencing mercury poisoning." That, of course, started me on a path to find out if this was actually some reality to this. And honestly, I felt like it would behoove me to at least look into it a little bit. So I did ask my general practitioner to at least give me an idea of where my mercury levels were at that point. Granted, I didn't have a baseline, but sure enough, they were elevated. And I think that at least provided some credence to, I guess, the believability in terms of what he had told me. At that point, of course, like I said, I had been practicing and building up my practice, but there was that thought that things could be done a little bit differently. This point into my career, pretty busy working 4 to 5 days a week, seeing close to 24 to 30 patients a day. Yes, just honestly, just feeling burnt out. And it wasn't until I stumbled upon this different philosophy that I realized that there could be a better way.
So where did you discover? Well, actually, back up. Starting that first practice, what would you have done differently? Like, what were the kind of the challenges and solutions you came up with? I mean, obviously, production wise and as a business, it was successful. But what would you change having start that practice, or what did you change when you started the holistic practice?
No, and that's a great question. And honestly, if I wasn't introduced, I probably wouldn't have done anything differently, just because. And this is part of it. I had allowed somebody else's definition of what success is to be my driver in terms of what I was looking to do, i.e. making sure that you're getting 5 to 10% revenue growth every single year, making sure that your patient population is growing at least 30 per month. Like those key performance indicators that every dental consultant says that needs to happen, that's supposed to be proof that your practice is successful, and were the things that I was looking to do. So I can't say I would have done anything differently if I was in the exact same place. I would say the one thing that I wish happened was that I was introduced to the holistic philosophy prior to starting my practice.
So
and granted,
I don't introduced to it. Where did it come from?
And yet again, a great question. I sort of spoke about it a second ago, but a classmate of mine who was an associate with me during my first position, he had the opportunity to moonlight under a doctor who was practicing that way. And I will never forget it, because the next week at work, he literally said something along the lines of, "You wouldn't believe the hocus pocus I just saw at this other office." I was like, "Really?" He was like, "Yeah, they're doing things that we've never even thought of, but it seems pretty cool, so I'm going to learn more about it." And I just brushed it off. Honestly, when he had given me that spiel to begin with, I didn't think two things of it. But when I realized, because we had opened up our practices around the same time, when he had said that he was making the transition like 3 years after he had started, and what that meant for him was him completely flipping the model that he had, because it was just a regular PPO practice, moving preferred provider under insurance organizations, and going completely fee for service. And I told him he was absolutely crazy, but sure enough, he did it, and I guess served as an indication that this philosophy of dentistry is possible. We honestly just moved in very similar paths, just in different philosophies. And I saw the growth pattern that he was experiencing. And yet again, letting other people determine what success is, when I saw that his revenues were exceeding mine, that's when I was like, maybe he is onto something.
Yeah.
But on top of the new health concerns that I had realized may be taking place, I think that's when I actually decided that maybe this is something that I should be looking into.
So what do you define success as now?
Oh, man, that's a great question. Me now is making sure that I can decide what I want to do on a daily basis. There's this thought that as an owner, a business owner, or as your own boss, that you are going to be the determiner of what happens, and that's something that you don't realize very quickly when you're in the beginning aspects or beginning parts of when you start your own business. And it's not just in the dental field, it's, at least to me, in all industries.
Yeah, absolutely. Well, so what does it look like because I've heard holistic in all sorts of different industries and realms of life. What does it look like for you, both in your practice in dentistry and then also in your personal life? Like, how are you, striving for that balance and regaining control of your life?
Absolutely. Ultimately, I would say for the beginning parts of when I started owning my own practice, that was the first thing that, of course, would take precedence in terms of making sure that tasks or duties are being completed. There's been a shift, and granted, the shift has been more towards what my true passion, or what I would consider my why, like, ultimately. And that's making sure that, first and foremost, me being the man that I'm supposed to be for my family, a husband, father. And that wasn't taking place initially. Granted, there was always the explanation, this is only going to be for a few years, and then after that we'll be able to make a decision on I guess how the time factor of things are going to work. 7 years later, that still wasn't the case. It was still me being shackled to the practice and making sure that I'm being there for the practice whenever I possibly can. Now it's completely different. During a period when I was working 8 to 5, like I said before, 4 to 5 days a week, I'm now working, I would say, 8 to 4, been given the opportunity to take vacations when I want to, be able to make it to events that my children are participating in. Like, those were things that ultimately were more of a luxury. Now that's the necessity. So to me, that's the biggest change for me, specifically from the holistic aspect of things. Another part of things that I didn't really take in consideration is the lifestyle of my team members. I try and make sure that not only that they are able to, of course, be financially compensated so that they can provide for their families as well, but be able to have the autonomy to be able to take time off. That's one thing that I'm most proud of at this point, because now they have the opportunity, based upon how the new office operates, to take a lot more time to be able to spend with their family, or to be able to take vacations when they want to. And all these things are still taking place with us being able to operate and be able to meet whatever financial goals that need to take place, based upon, of course, our overhead.
And then what about how that's translating into the patient experience? I mean, well, one, are the patients, how are you educating them on what it means to run a holistic practice, and how does that affect their treatment?
So, and honestly, you fed me perfectly there, Nick. Now I have patients that are actually appreciative of the care that we're able to provide for them. And no way, not saying that wasn't taking place before, but now it's it's the realization component that the patients now are able to see. With my first practice, it was very much volume driven. So the amount of time that we were able to spend with each individual patient was very much limited. With this philosophy that we have now, the time component is now the biggest value add for what we are able to offer to our patients. A simple example is the first touch point for a doctor, at least in my opinion, for regular general practice, is like during the first hygiene appointment of a new patient. And that's going to be maybe 15 to 20 minutes if that's allotted in a regular general dentistry practice. In our practice, their first touch point with the doctor is initially 2 hours, because ultimately we want them to have the opportunity to, for them to tell us their story. Clearly, every patient has an individual story, and ultimately, I think that's something that we've gone away from in terms of what we've been taught in dental school. Just specifically like our mantra in terms of how we operate is that every patient is an individual. We need to make sure that we're comprehensive as possible. And then the last part is do as little harm as possible. So be as conservative as we possibly can be. With our team knowing that, we try and make sure that we institute those things with every single patient that we do. And I mean, that we see. And ultimately that just has served as a nice beacon or guiding light for every patient that we're able to see in our practice.
So as far as growth goes now, I mean, if you're, are you doing less production then? Does that mean less revenue, but does that then ultimately it's more sustainable, or what's the balance like?
Believe it or not, we actually have more production. The difference is the amount of patients that we see. I know I used the term volume before. I use it in terms of the number of patients that have to be seen on a daily basis. That number has dramatically diminished since I've changed to this philosophy. Instances to where I was saying before, I was seeing like 24 to 30 patients a day is now down to like 15, and that's the norm in our practice. If it's more than that, my team knows that I'm not going to be happy, because that means I've done too much dentistry. Yeah. Ultimately, my job is to educate, let them have an understanding of why or when they may need to have treatment completed, or even if it needs to be treated at all, and then make sure that we deliver it with the best service possible.
Do you feel like spending more time with them in the initial consult ultimately means that, well, one, are they receiving better I mean, obviously, I guess then they're receiving better treatment and more attention. Does that also mean that that patient, potentially the treatments they're receiving are higher value from a revenue perspective? I know there's a disconnect there, but.
And it's hard to say that it's higher revenue. I think the key, I guess, value add for them is that they have a better understanding of what it is that they need.
Sure. Yeah.
Granted, with how we operate, yes, the procedures that we offer, it is at a more of a higher price point, but it's not to a detriment of the service that they're.
Well, now you're probably finding things that may have slipped through when you were seeing.
Absolutely.
Yeah.
Absolutely.
Well, and then, yeah, go on.
And I was just going to say, and it's wonderful to see that happen literally in the chair, when a patient will say, I've never had a doctor do as thorough of an exam and be able to spend the time to be able to explain it to me, because I've had other doctors say that I needed this, but I didn't understand why. Now I do.
Right. Well, and then what other like holistic systems did you put into place? Because obviously, doing the consults and the treatment procedures and everything's one thing, but how does the system work from, front desk to, treatment coordinator and ultimately seeing that they're getting the best care? What is some efficiencies or some holistic ideas that have gone into those systems?
Great question. So I would say the systems that we have for both philosophies are pretty similar. I think the biggest difference, and I know I touched on it before, but is the amount of time that we're able to spend with each individual patient. Now, from a clinical standpoint, in terms of how we're able to provide certain services or do certain procedures, there are ways that we go about doing them. For example, taking in consideration the type of materials that are being utilized from a restorative standpoint. And not to nerd out about dentistry, but if someone needed a crown, there are multiple options that is necessary. We take in consideration the makeup of that individual patient, meaning if there's an opportunity or if they have told us through the conversation that we had that they have realized that they have multiple sensitivities, we have the appropriate testing to make sure that we're utilizing the best material that's suited for them. And that's imperative in terms of making sure that the outcome, that the patient outcome that takes place is as best as it possibly can be. That aspect of how we go about providing dentistry was definitely not part of my curriculum at UNC. And I can't say that there is an institution that out there in the United States takes that in consideration.
Yeah. Well, and now you have, I mean, because of these systems, you have more of your time back, right? You're working less and I'm working more effectively. I'm curious maybe what tools or technology were responsible for getting some of your time back and making these efficiencies possible.
Great question. So I'll admit we have invested quite a bit in our practice. I would say we try and be on the cutting edge of technology, specifically from the diagnostic standpoint. We make sure that we have 3D renditions of our x-rays. That's going to be very important in terms of our ability to diagnose not only cavities, but potential soft tissue, potential issues, or, and my apology, I'm trying not to use too many technical terms, but
Oh, it's fine.
soft tissue issues or pathology, and then also like assessment of other parts, musculature, and like issues with jaw joints and stuff like that, or even airway, because now that is becoming part of the assessment with many of our patients, making sure that they're able to get restful nights of sleep and not having any issues in terms of respiration and things of that nature.
Yeah, and that's part of the oral, I mean, holistic health, right? It's not just the smile, but it's also
Correct.
the rest of the body.
Correct. And then also we have the ability to be able to, like I said before, choose the materials that we want to for restorative treatment. So we have the ability to fabricate most options in terms of restorative treatment. So inlays, onlays, full coverage crowns. We can't do it specifically, but there is technology out there that allows for 3D printing for us if we wanted to be able to make oral appliances that would be helpful for issues that deal with constant like teeth grinding or potential airway issues and whatnot.
Yeah. Well, sharing your why and knowing that your practice is different from so many other general practices, how do you end up communicating that to potential new patients or to the community?
That has a lot to do with, I guess, the grassroots marketing aspect of things that specifically our practice participates in. We've been very strategic to make sure that we seek out other like-minded practitioners. The majority of our patients come from other doctors who are aware of the fact that there are other ways to practice medicine rather than just a traditional allopathic method that most of our medical schools teach. This being functional medicine or integrative medicine, or there are some doctors of osteopathy. There are actually some chiropractors out there, physical therapists, just a number of different health practitioners that realize that there's a different way. So we, of course, just stop into their office, introduce ourselves to them, let them know that we understand what they're talking about. We have an understanding, and we talk to educate them on how potentially other people's their patients' oral health could be playing a part in terms of the systemic health issues that they're dealing with. Just to give an example, there's a lot of inflammatory conditions that are caused by things like tick bites, like Lyme disease specifically. There are a lot of symptoms and things that these doctors that doctors see that they know that potentially there are certain things that would be necessary from the oral hygiene standpoint that could be beneficial in terms of the treatments that they could offer, i.e. making sure that they don't have an imbalance of like the oral cavity, and that could take place with having a lot of different materials in their mouth. So they, of course, tell their patients to seek out a holistic or biological dentist that could, one, safely remove those materials and then put in a material that would be better suited for them so that it could help with their healing.
Are there any materials that you prefer right now?
Well, absolutely. And it's all inert materials, so composite resins for our direct restorations and ceramic crowns for our indirect restorations.
Wow. what about growth? So at this point, right, you've got your life back. You have a practice that's working, and you're feeling successful. What does growth look like? I mean, are you still following kind of the general, like adding 10% each year, and are you still kind of following those guidelines?
Absolutely. And granted, I'll say I'm still pretty early in terms of where I am in terms of practicing with this philosophy. I've been practicing for 18 years since I graduated, but this will be my 5th year that I've been practicing solely this philosophy of dentistry. And like you mentioned, the growth has been at a minimum at least 10% a year, which is, at least to me, been fantastic. I will say at this point, unless I were to get into a space that's larger, I think it'll be a little bit harder to see those type of, I guess, growth percentages per year. And ultimately, if that was to happen based upon how we're able to spend the amount of time with our patients, it would mean that we would need more space. Can't say that I'm quite ready for that, but I'm very happy with where we are in terms of that aspect. But knowing that practicing this philosophy of dentistry has been so life-changing to me, I'll admit I've now gotten the bug to want to educate other doctors about this. Recently, I did start a dental service organization that caters specifically to holistic or biological ways of practicing dentistry. And there's an educational component where I've started an institute to where we're providing education to these doctors so they can learn about these different procedures, how to go about actually operating a practice of this nature, and bringing on other holistically minded colleagues into the fold so that we can, of course, collaborate and hopefully bring up the next generation of wellness-driven dentists.
So rather than, getting a bigger space, you're expanding to other practices that already have
Correct.
them, right? And are you like acquiring the practices and having to train them on your idea of holistic dentistry then?
That would be the goal. Granted, at this point, I found that it's probably better suited to try and partner with other doctors that see the vision. That way they can also serve as potential educators as well, educators/trainers, and we could go through the process together. Granted, not every doctor is exactly the same, but ultimately, as from a fundamental standpoint, as long as we see eye to eye in that aspect of things, I think it's very possible.
And once you acquire more holistic practices under this DSO, how do you see continuing education play a part, and where do you think it's heading? Like, what's next to integrate into this model that obviously is working for you?
I think things come up as they come up. Prime example, I still do traditional dentistry, but we're starting to realize that there are other modalities that we can utilize. Like, currently, I'm looking into introducing red light therapy into our practice. What this is going to help with is wound healing. And I've utilized the laser in my dental practice since 2017, but in no way, shape, or form did I think I could utilize it to help with the ability for my patients to heal. Healing is, as I've never thought, has been something that I would be able to help with. That's something that we're looking to implement. Like I said, these things just come up as you learn about it. So honestly, I can't tell you specifically what potentially could be next, but I feel like when it does, it's always in my best interest to find out about it and see how it potentially could be implemented.
Well, I like the idea of, healing is holistic, right? Because
No,
that's what
absolutely.
you're doing. Every procedure, ideally, is, and I love the idea of adding red light therapy too. That's really making sure that your patients are being looked at as human beings, which is
Yeah,
your why, right?
yeah, absolutely.
Well, kind of my last question is, because obviously, in order to defeat burnout, you made a drastic change, right? But there had to have been like one spark or some catalyst, or like one small change you made right off the bat to initiate that massive shift. Do you have any ideas of what those are, what you'd recommend to a dentist or a doctor feeling burnout?
Yeah, I would say first and foremost, make sure that you're in a community of other doctors that you feel like you can speak to honestly. There's this thought that specifically in our field that we're siloed, especially if you are a single doctor, practitioner, or owner. There's very little time for you to be able to speak candidly with somebody else, just because there are so many other things that you have to deal with. If it means finding a study group or reconnecting with an old dental school classmate, anything, or even speak more candidly with a personal family member who may not even be in the profession, but someone that you feel like you can just be completely honest with. To me, that was my change. And I'll admit, it was me just being honest with my wife that I wanted us to have a better relationship. And that was a huge catalyst to me, one, spending the time to be able to make these changes. Granted, I won't say it's something that happens overnight. I've studied and taken hundreds of hours of continuing education for this transition to be successful and to be able to educate my team members, to be able to feel confident, to be able to speak to other people about this. That's been the greatest, at least part of the success that I feel like we've had. My team can speak to this without a doctoral degree, just as eloquently as I can about many of the things that we do in our practice.
Yeah. So where do people find you? Like, obviously you're interested in healing and sounds like you're invested in the community. So how do people connect with you if they want to take some first steps into overcoming burnout and seeing success as a holistic idea of growth and recontrolling your life?
Great question. So I would, there's two ways that you can reach me. It's either through my dental practice business, which is Integrative Holistic Dentistry, and our website is www.ihdnc.com. Or you can reach me through, my apologies, my dog probably sees something that's just something outside, or through my dental service organization, Integrative Holistic Alliance. And that's a lot easier of a website. It's www.integrativeholistical.com. We have email addresses, and that just can easily get in contact with me.
Awesome. Well, thanks for hopping on, Dr. Mensah. We'll make sure to include those links on there too, and when we release the podcast. And yeah, it's been a pleasure learning about holistic dentistry and your perspective and how far you've come in your career.
Thank you, Nick. And I commend you, man. I know you've been doing this for a while, just trying to find speakers and opportunities to talk about things that could be beneficial for our profession.
Thanks.